That is why I am issuing a directive to require COVID-19 immunization policies in hospitals, home and community service providers, and ambulance services.
Premier Doug Ford was peppered with questions about hospital care in his province amid stories of closures, overworked staff, and delays.
Make no mistake about it, there's a logjam, but 90% of the patients are getting taken care of when they're going into the hospital.
A lot of the nursing staff, they're not showing up for work. They are burnt out.
The patients are suffering because of this, and so are their workers, who they say they hold dear to their hearts.
You have staff, you have trained staff that is ready to work. Why would you not be bringing them back to work? It doesn't make sense.
Tamara Ugolini here for Rebel News at a church in Port Perry, Ontario, where there is a gathering of healthcare workers called the Healthcare Workers Support Day. And so I've heard that there will be approximately 100 people in attendance today, and obviously very healthcare heavy, to discuss the continued restrictions on that sector by the Ontario Ford government with vaccine mandates, and I suppose even just the mask mandates and the COVID hysteria that persists in the hospital and healthcare sector across the province. So we're here today to check out the scene, see what we can find out about what's happening on the scene and behind the scenes within the healthcare sector, and how the continued use of mandates affects people's livelihoods and, of course, the system as a whole. As we see in Ontario, the shortage of nurses and healthcare staff. And so many of the people who will be here today, from what I gather, will be affected by the government-related pandemic restrictions. So let's check it out.
I would also like to comment on the people who were forced, and I do say forced, I know everybody has a choice. I had colleagues that were literally on their knees bawling because they had to have a shot. They had to make tough choices between attending their kids' hockey games, keeping their homes.
August of 2021, Doug Ford put a mandate out with the health minister saying that all healthcare workers must be vaccinated.
But they dropped it.
No, they did. However, let me just clear the air. The hospitals got on board. They started implementing their policies. And the 11th hour, Doug Ford pulled the vaccine mandate. However, the hospitals followed through. They had everything in place. And that's what happened to my friend. He lost his job in his early 30s, a very, very skilled paramedic, a young guy with 3 young kids. And that's wrong.
I have a friend that is in his 30s, and he decided not to get vaccinated in Northern Ontario, and he was terminated back in November of last year. And there are so many other healthcare workers, thousands in Ontario, that have not been able to, they lost their jobs because they decided not to get the vaccine.
At the beginning of the pandemic, like when I got let go from my job, it felt like we're all alone. We're the only people that were in our position because nobody really talked. And then after a while, I got connected up with a chat group online through the United Healthcare Workers of Ontario. And then it turns out there was actually quite a few of us, like a lot of us.
I was terminated from my position under the guise of non-compliance to the vaccination mandate. So my county was actually quite good with me. I really don't think they wanted to follow through on it, but because it was such a government fearful mandate that was put down, they followed through on it, and I followed through on my end of it as well, that I was not going to be vaccinated. This vaccination came out too quickly, and it made me nervous.
I'm a PSW of 40 years, and I came out today to support the nurses and PSWs in Ontario that are being unfairly treated right now and being forced into take this lunacy vaccination, or you lose your job.
I worked in healthcare 10 years before I went to Emerge. You had to work many, many years and have a lot of experience before you could even apply to that job. Mm-hmm. Nurses from nursing school go straight to Emerge to work now.
I myself did not apply for any type of exemption. I just felt that I have body autonomy and that it should be ultimately my decision. Considering how healthcare is right now and that I worked in Emerge, I seen firsthand what was coming in the front door, how busy the Emerge was already.
A lot of the reporting that's going on in the mainstream news is not reporting the fact that a lot of the hospital shortages are due to the fact that there are unvaccinated staff that are not able to work. They have been fired, which is unfortunate, and that's not being covered.
How do you think that the government could approach this differently to see these unvaccinated healthcare workers reinstated?
They need to reinstate us first. They don't need to look to other countries to bring in immigrants to do our job. Start with us first. Bring us back. After all, they are allowing us to rub shoulders with each other at Costco.
I've had quite a few jobs over a year just to try and gain some new skills, because after 11 years of nursing, yeah, I'm good at being a nurse, but when you all of a sudden can't fulfill that position anymore because workplaces don't want you working for them, you have to try and build a new set of skills to make yourself more appealing to get a better job elsewhere.
The clients don't have the level of care anymore. They're replaced with people just out of college, no disrespect, but they don't have the experience, and short staff and things like that.
What they're not telling the public is, for example, nurses who, or any, let's take nurse for example, because they have a governing body, but they were told that if they resigned, they would not have a black mark on their record and the college would not get a report about their conduct. So you can be assured that for every nurse that was terminated, likely double that number resigned. And those people that are resigned, or those people that took early retirement, are not included in their small little demographic that they like to see.
So you're saying there's more of a
There is a large group of us, and they don't talk about that. They don't talk about specific numbers. I think the hospital corporations have minimized what their loss is and don't want to put numbers to it because it would look like something's not right here.
A lot of the nursing staff, they're not showing up for work. They are burnt out. So an emergency department that would normally have, for example, say 20 staff, now are running the same emerge with 10 to 15, if not less.
This has caused people to go into early retirement because they didn't want to have this vaccination or follow any other of the mandates while they were working because they just didn't think that they could physically wear a mask for 8-12 hours.
If you're able to mandate the support staff in schools in the education system back to work, why can't you mandate all the healthcare staff back to work? Because our healthcare system is failing our patients.
We as nurses have always been about informed consent, and it's like we took that away from us, the very people who educated our patients about informed consent, giving them the risks analysis and letting them make their own decisions. And that was taken away from us. So it's very frustrating.
I think it's a very scary time for patients. I think it's a very scary time to really think about your family member, perhaps you yourself as a patient, of what kind of healthcare you're going to get. You don't know. You don't know unless you are in healthcare to begin with. You think that you're going to get the best standard of care.
People are going into the hospital, and there's the nurses that sometimes would have like maybe 4 patients, and now are having up to 6 or 8, 10 patients. My father was in the hospital recently, about a year or so ago, and he waited hours and hours for a nurse to come and help him.
When we talk to our colleagues that are on the inside, they talk about the things that are going on inside, that they are committed to policies of confidentiality that they can't talk about. And that's not okay. When it comes to your parents' care or your grandparents' care, it should be full disclosure. There should be nothing kept quiet or secret.
The patients are suffering because of this, and so are their workers, who they say they hold dear to their hearts. They do not care about us at all to put us through this.
Many nurses would like to get their jobs back. Many support staff in healthcare facilities would also like to get their jobs back. So it would be nice if changes were made, if policies were lifted, that would allow us to get back to work.
When you allow visitors and other outside workers to come in who are unvaccinated, why not bring the unvaccinated nursing staff back to work?
You have staff, you have trained staff that is ready to work. Why would you not be bringing them back to work? It doesn't make sense.
I'm going to Costco. Why can't I go to work?
They just stonewall us. I want to see debate between the other half of the science and medical community that have been completely left out and called misinformationists. And they are, like us, putting our necks out there to to have a decent conversation about this, but they are just stonewalling us because they know that they have nothing. It's just them saying, you have to take it or else you are purged from society.
As we saw here this afternoon, the showing of healthcare workers was just the tip of the iceberg. There are so many healthcare workers who have been ousted from their job, whether it be due to mandates or even the pre-existing mandates of masking, those who just couldn't withstand that work environment. The event was mostly directed by the mainstream media, as we saw Avis Favero from CTV News. I wonder how much she recognizes the fact that these healthcare workers have been quiet. They've been silenced and they've been censored. They've been smeared and they have been ridiculed for the last 2 years. And so it's no surprise that they're angry and they're frustrated and they finally have an outlet to have their voices heard and they want to be heard. It's been a long time coming. The consensus is that the government is no longer imposing the Directive 6, which was the vaccine mandate geared toward hospitals and other healthcare institutions by the Doug Ford alleged conservatives under the medical health advice of Kieran Moore. So rather, the hospitals are responsible for the continued enforcement and policy of vaccine mandates. And of course, doctors being silenced and too scared by their governing body, the CPSO, another issue I've covered in depth, to even provide exemptions or speak out against these heavy-handed mandates. Many nurses spoke of not wanting to return to work because they have a tainted mindset now of the entire healthcare system and how it has handled itself and unfolded over the last 2 years. They expressed concern not only about the existing healthcare workers that are in hospital now and various other sectors, but also that patients are being adversely affected by the continued staffing shortages that remain largely ignored by all levels of government. Stay tuned for this report because as the mainstream media trickles out their reports, we're going to continue on this beat that we've been following for nearly 3 years. For Rebel News, I'm Tamara Ugolini. Rebel News took a firm stance against vaccine mandates from the onset, and we've conducted important work at fightvaccinepassports.com. At that special website, you can find out all of our previous reports on the subject and also chip in if you're able to help onboarded litigants resist these heavy-handed mandates. All of your donations go directly to the registered charity called the Democracy Fund, so your donation will be considered for a charitable receipt. You can find out more and check out our reports at fightvaccinepassports.com.